going to start about instrumental delivery. So what are the indications and prerequisites for instrumental delivery? Let us see. So first we need to start with indications. So in what conditions you will do instrumental delivery? The first one is prolonged second stage of labor. In the case of prolonged second stage of labor, where especially fetal head is already in +2 station. When the fetal head is greater than or equal to +2 station means it has engaged. The fetal head has got already engaged. So in this case, it's better to do instrumental delivery rather than doing cesarean section because already head has come down, right? And other indication is fetal distress because already the fetal is in problem, fetal is in distress, and especially in fetal distress also, if the head is greater than or equal to +2 only, you will do this because the fetus may die in very few minutes or seconds. So it's better to do instrumental delivery. And also, if you want to cut short, if you want to short the second stage of labor, in some cases you want to short the second stage of labor, then in this case if you use instrumental delivery, then it is called as prophylactic use of forceps or vacuum. So you can use forceps or vacuum. Actually, forceps and vacuum are nothing but called as instrumental delivery. So in the case if you want to cut the second stage of labor, then it is called prophylactic use. And especially this is used in the case of maternal exhaustion. Mother is not able to give the pull to push out the baby. In this case, you will use these instruments. And in the patients already they have heart disease in the mother and PIH, already mother is in hypertension, so now you can't force the mother to push the baby. So in this cases you'll use instrument. Now coming to prerequisites. So what are that prerequisites required for instrumental delivery? That is, take the consent and give episiotomy. You should ask the patient and do episiotomy, so that with the instrument also it would be very easy to bring the baby head down. And of course cervix will be fully dilated. If the cervix is fully dilated, then only you can get out the baby, right? And head also should be engaged. That is the main important thing. Head should be engaged, that is greater than or equal to +2. This point we are discussing now thrice, right? So head should be rotated. This is one more important. Rotated head should be rotated, like either it should be in direct occipito anterior or direct occipito posterior, or it can be in right occipito anterior or in the left occipito anterior. These are the positions which are required actually. That is, this right occipito anterior and left occipito anterior makes an angle of 45 degrees on each side. So maximum this much of rotation is required for the case of instrumental delivery. Next, coming to the pelvis. Pelvis, there should be no contracted pelvis. Of course, if the pelvis is contracted, even if you try with the instrument, the baby head will not come, okay? And there should be no CPD because already the head of the baby can't accommodate the pelvis. So in this case, if you try to drag with the instrument, there is no use. So never apply any instruments in CPD. And coming to uterus, uterus should be contracting. Of course, when the uterus is contracting, then it will be easy for you to drag it with the help of instruments. And of course, bladder should be empty. So bladder should be empty and uterus should be contracting. C means contracting. Okay, now let us see what are the different types of instruments which you use for delivery. The types are either you use forceps or you use vacuum. Vacuum is most it's mostly used when compared with forceps. So forceps, all the prerequisites as we discussed just now, all those should be fulfilled, then only you can use. And for the vacuum, it can be applied even if cervix is less than 6 centimeters. So even if the cervix is greater than or equal to 6 centimeters, and in the case of non-rotated head also, you can use a vacuum more. Okay, but the conditions are like, if head is completely rotated and if cervix is fully dilated, and even with vacuum will get very nice results, right? So the conditions where vacuum is contraindicated but forceps is used. Now let us see that one. Okay, so forceps is used mostly here. What are those conditions? Let us see. The first one is preterm babies. In preterm babies, already the baby is preterm. Now if you try to drag with the vacuum, it is hard, so you use forceps. And in the case of intrauterine dead baby because the head is macerated. Now if you put the vacuum, it will can't give that much desired pressures, right? And after coming head of breech, the body of the baby has come out and only head is left. Now if you there's no space to apply vacuum, so here you'll use instruments like forceps. Okay, after coming head of breech. And face presentation, especially mento anterior position. So in this case also you'll use forceps. So forceps is preferred here in the case of preterm babies, in the case of IUD, intrauterine death, in the case of after coming head of breech, in the case of face presentation where there is mento anterior position. So vacuum is only used in vertex presentation. This is very important. Vertex presentation only you can use vacuum. V for V. Okay. Vacuum vertex. Condition where forceps is preferred over vacuum is heart disease in mother. In heart disease in mother, you use forceps greater than vacuum. Why? Because forceps is greater than vacuum in the case of heart disease, because actually even in the vacuum you need mother, push mother. Pressure is required even in vacuum, but in a heart disease patient we don't want to have pressure from the mother, so we use forceps. Now coming to absolute contraindications for instrumental delivery. CPD, of course, inadequate pelvis, of course, or contracted pelvis, and non-bony deformities, like for example already fetus has osteogenesis imperfecta and already the fetus is having coagulopathy. So in these cases you can't use any instrument, not only vacuum, not only forceps. Direct you need to do cesarean section. Okay, so now coming to vacuum delivery, let us start. What is vacuum delivery? So let us start with vacuum delivery. So nowadays we are using Celastic cups. So Celastic cups are actually which I use softer and they are less traumatic, and also they're easy to apply. So the shape is like either bell shape. For example, let me draw this. So this is how a Celastic cup looks. Okay, so it is like a bell shaped, or you can say mushroom shape. And Celastic cups are attached to the suction machine here. So initial pressure which is generated in the suction machine is 0.2 kilograms per centimeter square, and the maximum pressure which is generated is 0.8 kilograms per centimeter square, or you can say 600 millimeters of mercury. So this is how we apply the pressure in ciliatic cups. So criteria is that the pressure can be generated in 2 minutes. So vacuum can be useful in especially fetal distress. Okay. So correct application of vacuum. The center of cup should be at flexion point. So what is flexion point? I will show you now. Vacuum. So the center of cup should be on flexion point. So this is called as flexion point. So actually what is flexion point? Let me say it now. So this is the anterior fontanelle. This is the posterior fontanelle. How I said, you can see diamond shape is anterior fontanelle and the posterior fontanelle is a triangular shape. So by this you can find out. And if I draw an imaginary cup like here, the cup of this cup, a vacuum cup. So if I draw that, if you see that from the flexion point to the posterior fontanelle the distance is about 3 centimeters, and from the flexion point to the anterior fontanelle the total distance is 6 centimeters. But if you see from the rim of the vacuum cup and the anterior fontanelle the distance is 3 centimeters. So this distance is very important. The cup commonly used as a diameter of 6 centimeters. Okay, this cup diameter is 6 centimeters. When correctly placed, the edge of the cup touches the posterior fontanelle. Here actually is a posterior fontanelle. You can say the edge is touching with the rim of the cup. So distance between the center of cup and the anterior fontanelle is 6 centimeter. The distance between the edge of the cup and the anterior fontanelle is 3 centimeter. And if the cup is anteriorly placed, it can lead to extension of head. If you place this cup on anterior side, then it will lead to extension of head in the fetus. So newer vacuum device is available that is called as Omni cup. Omnicup is a new cup which we use. It has an inbuilt pump to create vacuum, but it is smaller in size and it is disposable and it is portable, and it can be used for both OA and OP deliveries. So this is the Omnicup. Actually, it is a short device which is used nowadays. It looks somewhat like this. Now coming to forceps delivery. So first we need to understand what are the different parts of the forceps. So if I draw a forceps here, so the forceps look like this. This is first we need to say the parts of the forceps. Okay, this is called as the blade of forceps, and this is called as shank of forceps, and this is called as handle. Okay, and here only it has a lock. And the blade of the forceps is having two parts. One is the cephalic curve, one is the uh, pelvic curve. So what is cephalic curve? Let us see the inner part, this curve, the part which I am thickening now. Okay, this one is called as cephalic curve. Okay, and this one, this whole outer edge, this one is called as pelvic curve. The right position in holding the forceps is, always remember that the pelvic curve should be upward. You can see here actually the pelvic curve is upward, but you see here the pelvic curve is going downwards. So on which side the pelvic curve is going upward? That is the right side. So what is the advantages of fenestrations on blade? It makes it light, less trauma and less compression on baby head. Actually here there are some fenestrations which are present on these blades. Why these fenestrations are present? Because it makes it light, and also it is causing less trauma to head of the fetus, and also it is causing less compression on baby head. So coming to the locks of the blade, there are two types of lock. One is called as English lock, another one is called as sliding lock. So the most common lock is English lock. It has two sockets, one in each handle, and the most common always left blade is introduced first. Actually, how to identify left blade or right blade? For example, if this socket which is present on upward, then it is a left blade. The same forceps and it is downward, the socket is downward, then this is a right blade. So always the left one should be introduced first and the right one should be second. So this is how you need to identify the right and left forceps. Okay, the correct placement holding pelvic curve should be facing upwards. Incorrectly held position, socket of one of the blade will be upwards, the other will be downwards. Left forceps, the socket will be facing upwards in correctly held position. Right forceps, the socket will be facing downwards in correctly held position. Identify the correctly applied forceps. Lock will be closed properly. Two blades after application will be equidistant from sagittal suture. For example, this is a sagittal suture of a head of the baby. Then these two forceps should be equidistant from sagittal suture of the baby. Now coming to various types of forceps. The first one is Wrigley forceps. So Wrigley forceps is also called as outlet forceps. Actually it is short, light, and its total length is 27.5 centimeters and its shank is 2.5 centimeters. This all we need to remember. Next coming to K-land forceps. This is a long forceps, the only forceps which can rotate head of fetus. Can rotate the head here, and it's a rotational forceps, but it's outdated. It has sliding lock. Remember, it is outdated. Now coming to Piper's forceps. Piper forceps is a long forceps, and it is with English lock, and it is longest forceps. It is used for delivering after coming head of breech. After coming head of breech. Next coming to Tucker McLean forceps. Tucker McLean is the only forceps with solid blade. It is having a solid blade. Now let us understand how to apply the forceps. Forceps application, low forceps application, low forceps outlet. You can see here the Wrigley is a outlet, okay. Low forceps means the station of fetal head should be greater than +2 but has not reached perineum. Most forceps are low forceps. So this all forceps are, you can say, low forceps. You need to apply them when the station is +2 and it is not reached the perineum yet. Coming to outlet forceps like Wrigley, it is used head on perineum. The scalp is visible at introitus, skull on pelvic floor. Ideally for applying outlet forceps is sagittal shooter should be in AP diameter. So like this, sagittal shooter will be anterior posterior diameter. Then you will use this outlet forceps. Note that mid cavity forceps application applied when head of fetus is at 0 or +1 station. High forceps application used when head of baby is above ischial spine. Mid cavity and high forceps application are not done nowadays, so I am not discussing about them. Now coming to direction of pull when applying forceps. So you have applied forceps, how to pull. So for the pull, you need to see the first position of the mother should be in lithotomy position, okay, and the direction of pull is based on maternal abdomen, okay. Let me show this diagram. This diagram shows the lithotomy position of the mother, and you can see this is the forward direction, this is the backward direction. Because it is forward because it's up according to the mother, and backward because it's backward towards the mother, and this is upward because this is towards the mother face side, and this is downward because this is mother lower side, and this is downward and backward because it is towards the mother's downward and backward side, and this is downward and forward because it's towards the downward and forward side of the mother. Now let us see direction of pull in low forceps. So in low forceps, you need to first pull downward and backward, followed by second pull which should be downward, and third pull should be downward and forward. So these are the pulls you do in low forceps. In the case of outlet forceps, here you will first pull will be downward, and the second pull will be downward and forwards. So these are the pulls you need to follow in low and outlet forceps. Now coming to traction force applied. Traction force applied in the case of primigravida is 16 to 18 kgs. In the case of multigravida is 12 to 13 kgs. And in a correctly applied forceps, the diameter along which the forceps will be applied is the occipitomental diameter of fetal head. Now coming to complications of forceps and vacuum delivery. For the forceps, the complications are more maternal injury, okay, and the fetal complications are facial nerve palsy, brachial plexus injury, corneal injury. In the case of vacuum delivery, more fetal injury, and fetal complications are 6 nerve palsy, shoulder dystocia, cephalohematoma, subgaleal hemorrhages, retinal injury. All these are complications. And coming to failed forceps or vacuum delivery. Here it is defined as 3 failed trials to deliver the fetus head. So actually we have tried 3 times, still the head is not delivering. Then here the management is immediate cesarean section, okay, if the fetal is in distress. So by this we completed instrumental delivery. Next we will start with cesarean section.